Hello and good evening and welcome to you all. Thank you for joining us this evening at this chat about egg donation at Institut Marquès. If you have any questions, please do send them to us. We may be able to go through them at the end. Please put them for all participants so that we can all see them, so that the questions don't repeat themselves, and we'll try to answer as many as we can at the end. In this talk, I'm going to outline a few things. First of all, why do women in general need egg donation in the first place? Why do women come from all over the world to Spain and to the Institut Marquès? How are the donors selected and assigned to the recipients? Are there donors of all races and physical traits for everyone? And what are the chances of success? Then we'll move on to what can the recipient know about the donors, how is long-distance treatment organized, a little bit about the medical preparation at the end, and a few little extra things before we move on to the questions. So first of all, why do more and more women need egg donation? Everything is related principally to having to wait too long, waiting too long to actually start having children. Culturally, women are obviously better educated than they might have been maybe 50 years ago. We're working, we're trying to do everything, we've got professions, and children just don't seem to fit in with that. Socially, women are marrying later or not at all, and they're waiting, they want to give, if they're thinking of having a child, they want to give that child stability themselves and not just wait for a husband to do it. So they're waiting to be able to offer stability to a child. The family models are changing. Single women, when they reach the end of their 30s and 40s, are thinking about having treatment themselves alone without having a partner. And divorced women may often want to start a second family, maybe with a new partner. And the medical changes that have accompanied all these social and cultural changes have allowed this to occur. So the pill has made waiting possible, the contraceptive pill, and the assisted reproductive techniques that we offer here have allowed older women to fall pregnant. There are a lot of misconceptions in society, primarily that regular periods indicates that you are fertile, and that's not always true. When you're over 35, your ovaries are often not nearly as good as your face or your body. The varying quality, the quality of the eggs produced by the ovaries in women over 35 are relatively poor. And how do we know that? Well, we do IVF quite often in women in their late 30s and 40s, and we analyze those embryos genetically in quite a lot of cases, and we can see that women in their late 30s and early 40s, about 85% of the embryos they create are genetically abnormal. So why do women choose to come to Spain for their egg donation? And when you look at Europe, 50% of the egg donation that occurs in the whole of Europe does occur in Spain. Well, you may all be aware, those of you in the UK are almost certainly aware that egg donation does exist there, but the donors are not anonymous. They may, 20, 30 years down the line, find that a child is trying to seek them. And here in Spain, donation is anonymous, and that probably does pull, that almost certainly pulls a lot of people towards Spain. We also have numerous young, fertile donors, and that's fundamental to the success rates, which I'll go through, I'll go through briefly later. Here in Spain, we offer, though, an environment of technological excellence. Just as an example, here at the Institut Marquès, we've recently acquired a new incubator called the Embryoscope. What does it do? Well, it's an incubator, and the embryos just sit in it for a few days, but they're not taken out. They're just left in there, and they're kept in a very constant environment. We can then allow the patients to access the images taken of the embryos whilst they're in there from home, which is a really nice thing for the patients to have. But more fundamentally, it allows the embryologist to see in detail exactly what the embryos are doing at virtually all the time. That gives them additional information. It allows them to select the embryos much better, and that's really useful information. So things like that exist here in Spain with us in particular. Also in Spain in general, there are very large centres, and the statistics have shown that the bigger the centre, usually the better the results. And why is that the case? Well, when you're a big centre, you can bring in the best professionals, you can buy the best medical equipment, and you can invest in the newest and most up-to-date technology. We found it is our experience here at the Institut Marquès that if you're going for egg donation, that's often not enough. You need the help of geneticists, of andrologists, more detailed embryologists and things like that. They really are necessary to be able to work out exactly what is going on, because egg donation doesn't always solve everything. And of course, here at the Institut Marquès, we have great experience. That's another reason for it's one of the main reasons for coming to us. There's great experience here in the centre. The Institut Marquès has been in existence for 90 years. We're celebrating that this year. 4 generations of Dr. Marquès have been working here, and we've been doing fertility treatment for about 20 years. So there's a lot of experience here, as well as in Spain in general. So on to you and the donors. How are the donors selected and assigned? Well, principally the donors are aged between 18 and 35. The average is about 25 years of age. When they come to us, we take a very detailed medical history, both with direct questioning regarding the donor's own history and her family medical history. We examine the donor. We send her for blood tests to make sure her karyotype is normal. So she's got a 46XX karyotype. We check she's not a carrier of HIV, hepatitis B, C, syphilis. We check she's not a carrier of cystic fibrosis, which is one of the most common genetic illnesses in Europe. And we check her hormones, because obviously we don't want her to have an unexpected premature ovarian failure or anything like that. The donors also undergo a certain degree of psychological testing, making sure that they understand what they're doing, what they're undertaking, and why, and the long-term implications. If we had to summarize about the character of the donors who come to us, I would say that they are brave women, they're thoughtful, they're open-minded, because if you imagine a donor coming, if she's worried about needles, if she's worried about going for a general anesthetic, or if she's worried that by donating to someone else she's not going to have any eggs left for herself, then she won't come. I mean, that's the main thing. So those who do come are aware of all those things and still want to make the donation. They often say that they want to help. They've had a friend who's been through infertility and they wanted to help her. You can't, because it's anonymous here in Spain, so you have to help someone else. And they often donate blood, bone marrow, and other things as well. So it's quite normal to be a donor here in Barcelona in particular, but also, I think, the rest of Spain. So how do we assign the donors to the recipients? Well, we use the blood groups of the recipients to match with the donor and the physical characteristics of the donor to the recipient. The recipient has actually no choice in who her donor will be. We consider that it's a big responsibility, and it's an honor that people let us do this for them, because if the treatment works, it's going to make a huge difference to the recipient's life. So we take the linking of the donor to the recipient very seriously, and fundamental to it working well, the recipients have to trust us in that assignation, in the donor assignation. It can only work if the recipients trust us, and trust us to do it well. Do we have donors of all racial types? Well, the majority of our donors are Caucasian, Mediterranean, but we do have some Black and Asian donors. Many of our donors are willing to just wait on the contraceptive pill, just cycling on the contraceptive pill, until a recipient with the donor's particular characteristics comes along and needs her help. So we can just call these donors, and they are usually quite flexible to do a cycle when it suits the recipient, and of course when it suits them as well. What are the chances of success? Well, the most recent data shows that at the moment our success rate per cycle meaning the eggs created from one single donor, so that includes a fresh transfer plus as many frozen transfers as can be created. The success rate is currently 69.6%. How can we explain that high rate? Well, we have young donors. They aren't infertile as far as we're aware. This helps the embryos to implant very much. We prepare the recipient's uterus to receive the embryos. And if things don't go as planned, we do extra investigations on the uterus and on the sperm. And of course, then we've also got all the other technology, the genetic assessments of the embryos and the uterus and the embryoscope I mentioned earlier. Lots of other sperm techniques. We've got all of that to try to help the success rates go up, and that's how we can explain those results. We also have a refunding scheme, and we know that over 3 complete cycles, we have a success rate of over 90%. So nearly everybody gets there at some point. And if you're in the refunding scheme and you're not successful, you get 70% of the money back. So it's quite an interesting thing to go for. Now, what can the recipient know about her donor? Well, as I mentioned earlier, the donor is assigned by the medical team. We actually prepare 2 donors for each recipient. There's a main donor and a backup donor, and the backup donor is equally matched to the main. I'm looking at the questions at the same time. I can see I'm not speaking loudly enough. Sorry, I'll try to speak more loudly. Sorry. So the donors, we prepare 2 donors, and they're both equally matched to the recipient. Usually it's the main donor who does donate to the recipient, but if something happens to the main donor, so the main donor falls off her moped, or we don't collect the right number of eggs, or something happens, the donor doesn't respond to the treatment in the way we're expecting, then we have the backup donor there as a kind of insurance scheme for the recipient. And because there are 2 donors, we only give the information about exactly who has been the donor on the day of egg collection. The day of embryo transfer. And on that day, we will tell the recipient the blood group of the donor, the age of the donor, and her basic physical characteristics. Throughout this process, though, everything is anonymous. There will never be any information given to the recipient that could identify, at a later date, the donor. Many of the patients worry that the donors may have something in their medical history that could come out in any child created. But I think any recipients need to feel that we wouldn't accept a donor who has any medical problem that we're aware of, either by tests or direct questioning. So we wouldn't allow her to donate if we think that she's going to create an unhealthy child or embryo. So how do we organise long-distance treatment? More and more doctors in different countries, in the UK and Ireland, are making direct referrals to us. But still, the majority of our patients do just take the initiative and contact us themselves directly. Generally, they contact us here in Barcelona, but we do have the offices, the administrative offices in London and Dublin as well, and there are staff there waiting to be able to help people orientate themselves in the system and advise them as well. So patients usually make that first contact by telephone or by email. Then, following that first contact, a first visit is organised. The majority of the first visits take place here in Barcelona. So the patients come, they meet their doctor, they see the site, they leave a sperm sample very often to freeze. We do an ultrasound to check the pelvis of the recipient, to do a catheter test, and we give the patient the medication to take home with her so that she can then start when she's ready. But for those patients who find it very difficult to come to Barcelona for one reason or another, we can organise first visits by telephone or by Skype. And in those cases, the patients then send things like their ultrasound results, sperm test results to Barcelona, and we then send back the medication and so forth. Following the first visit, there's then an exchange of emails regarding further follow-up tests that might be requested, the results, depending on what's needed. And then the treatment is organised. When the treatment is organised, the patients then come for egg collection if they haven't been able to leave a sperm sample beforehand. So they come on the day of the donor egg collection, their partner leaves the sperm if they have a partner, and also if the sperm sample is really terrible, often we will ask the patients to produce a fresh sample. But for those who've left a good sperm sample and we've been able to freeze it, then the patients just need to come for embryo transfer. And so in general, the return trip to Barcelona is between 2 and 5 days stay maximum. It's not usually, doesn't need to be any longer than that, although often patients spread it out and sort of make it a holiday. We have different levels of staff to be able to help the patients as well. We have patient assistants, and they are the administrative staff who organise the first visits. They're the person often the first point of contact for the Institut Marquès. They speak lots of different languages, can accommodate most of the European languages and a few others besides. And so they can make the contact in the patient's, usually in the patient's own language. And then once you're into the realm of the following the first visit, organising the treatment, we have medical assistants who will also be able to help organise things, usually in your own language as well. You then also have the doctor who is specifically assigned to you, whom you've met before, either through the Skype visit, the telephone conversation, or the first visit. And that doctor is responsible for you, but you may not see that doctor on the return, because if, for example, your transfer occurs at the weekend, the doctor may not be on call or whatever. But that doesn't matter. That doctor will be aware of what's been happening to you, will be in contact with you, either prior to transfer, before transfer, that kind of thing, will have set everything up. And then you have the rest of the medical team who will be able to look after you when you actually come here for the transfer, if it's not your own doctor. And then there's the 24-hour emergency service that runs 365 days of the year. So if you need to see a doctor and it's urgent, or not see, but speak to a doctor, you can always get hold of someone at any time. So that's, I think, reassuring for patients, especially when they're far away and they can't necessarily see their own doctor at home, but they want to speak to someone who knows their case as well. The medical preparation that the recipients would undergo is quite simple, especially compared with IVF, because obviously it's the donors who are undergoing IVF. The recipients are doing something a bit different. What we usually ask recipients to do is start on a contraceptive pill. And why a contraceptive pill? Well, just to synchronize the menstrual cycle of the recipient with that of the donor. Why do we want to synchronize? Well, we have a greater success rate if we have fresh embryos. So we synchronize in the first instance so that we have an egg collection and an embryo transfer that occurs with fresh embryos. Once we've synchronized the donors with the recipient, the recipient will then start some estradiol patches to prepare her uterus, and she will have a scan at home to be able to check the lining thickness, the endometrial thickness, to make sure it's 5 millimeters or more. When she's ready for egg collection and embryo transfer, we will ask her to start some progesterone pessaries into the vagina, similar to the ones that are often used in IVF. So the recipient will come for embryo transfer. She's got her estradiol, either patches or pills. She's got her progesterone pessaries in the vagina, and she'll have transfer. And normally transfer would occur on day 2 or 3, but we do transfers more and more on day 5. That's something to discuss with the doctor when you meet him or her. We usually, with fresh embryos, would transfer 1 or 2 fresh embryos. With frozen embryos, we might transfer up to 3. It depends on the quality of all these embryos. It depends on what the patients want. It depends on what the embryologists advise. This is something that can only be decided on the day when we know exactly what we're dealing with, as it were. The embryo transfer takes place whilst you're awake. It's a daycare procedure. You come in, it usually takes about 10 minutes to do, and you can travel home the same day if necessary. You then continue with the medication until the pregnancy test. If it's positive, you increase the doses of both medications and keep going for another 10 weeks. That's necessary because your ovaries have been shut down. It's not like IVF in that sense. So you keep going with the medication. At the end of the 10 weeks, you stop the medication on a date that we can give you, a specific date, and then from then on, you have a normal pregnancy. Now, here I've got a letter that I received last week, just out of the blue, and I think this is the end of, pretty much the end of the talk, but it highlights very much that when you do egg donation, the child that is created is your child. It's never going to be anyone else's child. It's never going to be the donor's child. It will be your child if it works. So it's just a letter that, as I say, it came out of the blue. I've changed the names of the children to maintain their anonymity, but it was just such a nice letter. I thought you might like to hear it. So it's dated June 2012. Dear kind lady, I wanted to write to you to let you know how much we appreciate your donating your eggs to enable us to create our family. Thanks to your generosity, we have a daughter called Jessica, who was 5 in January, and a son called Paul, who was 3 at Easter. This Christmas, Jessica was chosen to play the part of Mary in her first school play, and her innate and learnt mothering skills touched the hearts of the entire audience as she sang to the Jesus doll as if it were a real baby. Our children play together constantly, clearly enjoying each other's company, games of make-believe, stories and role-play, loosely based on that day's activity. Paul might be building the aeroplane from cushions on the floor, whilst Jessica is busy serving food to Teddy and Dolly, the passengers. They adore each other as much as my husband and I love them. Becoming a mother in this way has been an incredibly joyful experience for me, and it is impossible to put into words how enormously grateful I am to you, twice. As a family, we speak about you often and wonder about you. We refer to you as the kind lady, and we would love to know more about you. I hope you will enjoy the enclosed drawings by the children. With warmest wishes for your future happiness, Sally. So, well, it speaks for itself, really. So now we've got time for some questions. I've got a few here that I can see. Oh my goodness, there's so many. Yeah, obviously that's a big question. Somebody's asking about the cost involved. A single cycle of egg donation costs about €10,000, and that's not in the refunding scheme. So that's just a single cycle, €10,000. In the refunding scheme, it's €30,000 up front, but if you're not successful, you get 70% of that back again. Success rates for IVF in women of my age group, I'm 46 and my husband is 49. The success rates in theory are the same for all women doing egg donation because your success rate is primarily based on the age of the donor. So your donor is, let's say, 25, then you should have, in theory, the success rate of a 35-year-old. In practice, that may not be the case because often people who come to us have a very long history of infertility, and we often find it's a history of mixed infertility, even though they're being sent to us for egg donation. So that's something we have to try and work through. But in theory, your age should not be an impediment to falling pregnant, whether you're 30 and you've been through a premature menopause, or you're 49/50. Can we do a first-time consultation and egg donation at the same time? No, I'm afraid not. Why do I say no? Principally because it takes time to find the right donor for someone. Start to finish, the quickest we can probably do it is about 4 weeks. The starting point is the recipient's period. If she doesn't have periods, we would have to create some usually. So the period is the starting point, and then embryo transfer is usually about 4 to 6 weeks later. That would probably be the quickest we could do everything. Is a frozen sperm sample equally as viable as a fresh sample? Yes, if the fresh sample is of good quality. Fresh samples can often lose a bit of quality on freezing, as you all know. But if everything starts with very good parameters, if you lose a bit, well, you're still within normal parameters. However, if you start with really rubbish parameters, low concentration, low motility, freezing, it's just going to make it worse. So your doctor will be able to advise you whether we think it would be better to provide a fresh sample or would it be better to use a frozen sample. And of course, your choice matters, and if you want to give a fresh sample, you can. How long would one have to be in Barcelona if one comes for a first visit? Well, a first visit takes about 2 hours, and we quite often, patients quite often just fly in the morning and fly home in the afternoon. So it can be done all in one day. But we are not open for first visits at the weekend. We are open for embryo transfers of fresh embryos, egg collections and things like that at the weekends, but we don't do first visits at the weekend currently. I have green eyes and my partner blue eyes. Does my donor need the same colour eyes? We do try to match eye colour as closely as we can, but the genetics of eye colour are not as simple as we always thought they were when I was learning at school, that kind of thing. So we will try to weight things in your favour by giving you a blue-eye donor if you have blue eyes, such that if your husband also has blue eyes, you'll increase the chances of having a blue-eyed child. But you have to remember this is Spain. The donor may have a little, very dark grandmother somewhere in her background, and that could come out. Although, as I say, we try to weight things such that, you have a child created who's compatible with you and your partner. Is the process the same as IVF? I don't know if I understand the question. If there is another problem, so if you do IVF and you've had 3 attempts, then usually one would be sent for egg donation. We would try and make an alternative diagnosis before someone reaches 3 cycles of egg donation. If we're not successful with the first cycle, well, that can be bad luck. Second cycle, we tend to feel that that's, starting to be less bad luck, but more something else. And we'll recommend a lot of other tests on the sperm, on the uterus, blood tests to check the hematological parameters of the recipient to make sure we're not missing something. that kind of thing. What's the average number of times before a successful pregnancy in women aged 43 to 44? Well, I think the age I've covered before. It should be related to the age of your donor. The average success rate with us, as I mentioned before, is about 65%, 70%, with fresh transfers particularly. And we know that with a refunding scheme, you have a 90% success rate over 3 cycles. So, you know, how long is a piece of string, really? Most people are successful in the first couple of cycles, but some people, it does take them longer. I am a single patient, I'm a single woman. Does this matter? Not at all. We can find sperm, we have a sperm bank affiliated to the INSTITUT MARQUÈS. We can find sperm bank donors, sperm donors of pretty much any racial type, and we can organise that quite easily. How quickly can you have a first visit? Well, if you contact us tomorrow, hopefully someone will get back to you tomorrow, but it might be Monday. Usually it's within a few days. How do we organise scans and blood tests needed in the UK? Would it be through my GP? Well, the GPs often help as much as they can help. But the NHS is a very slow-moving machine. I know I used to work in it for a long time, and so it can't deal with very short request times. So when you start the estradiol preparation for egg donation, we often want a scan 7 days later. The NHS often can't deal with that. So in practice, a lot of patients go to private clinics, often the fertility centres that have sent them to us. Could the sperm donation be open rather than anonymous? No. All donation in Spain has to be anonymous. So you can't come to us saying, well, I've got a really great friend who would like to be a donor for me. He might be able to be a donor into the sperm bank, but he couldn't donate directly to you. That was a question. Yes, in this cost of €10,000, how many eggs do you guarantee? We guarantee a minimum of 6 mature eggs. 7 to 9 is actually the average, but 6 is the minimum. Some people say, well, that's not very many. With my IVF cycles in my late 30s, I was producing a lot more. But you have to remember that what we're going for is quality, not quantity. The women are young, they're not infertile, we don't want to overstimulate them, we don't want to make them ill, we want them to repeat, we want them to do everything for you, the recipient, and make sure that they're going to produce the best quality eggs for you. So it's a minimum of 6. If there are fewer than 6, we will go to your backup donor, and that's why we have a backup donor there for you. If someone has suffered a miscarriage, does egg donation reduce the chance of this? Well, it depends on the cause of the miscarriage. If you're 38, as this patient is, you may have a certain degree of aging of your eggs, and maybe you're miscarrying because of the genetic quality of your eggs. But equally, maybe if you've been trying for 10 or 15 years with your partner, maybe there's nothing wrong with your eggs, and it might be something wrong with your husband's sperm, or indeed there might be something wrong with your uterus, and it's sort of provoking the miscarriage. Or it might be something to do with your blood, and you've actually got a problem with your blood. It could be any of these things. We have 2 cycles of IVF, sorry, I'm very hot, 2 cycles of IVF using our own eggs and sperm, which have resulted in 100% fragmentation. Do we recommend donor eggs? I'm assuming that means 100% fragmentation in the embryos created. If sperm DNA is fine, well, donor eggs may well help. It's quite likely they will help, but it depends on your age, and we'd need to know a little bit more about your history to be able to sort of in any way guarantee that. So you only use sperm bank in Spain, or I can choose myself from another sperm bank? No, we have our own sperm bank here, as I said, affiliated to the Institut Marquès. We choose who you have. You can't bring a sperm from a different sperm bank, but we are affiliated also with other sperm banks. So, for example, if you are Scandinavian, blonde with blue eyes, we can find you a donor like that here, but you may want a Scandinavian donor, male donor, and we have links with sperm banks in Denmark, and they can provide a truly Scandinavian donor. Is that 69% success rate pregnancy success rate or live birth rate? That's the pregnancy success rate. We have, on average in our centre, about a 10% miscarriage rate. So you can calculate that if your pregnancy test is positive, you'll probably have about a 55 to 59% chance of a live birth. How much would egg plus sperm donation be? Well, sperm donation is much, much cheaper. It adds about 300 to 500 euros to the cost of egg donation, so it really isn't very much. With an anti-Müllerian hormone level of 0.18, what is your recommendation? Well, you haven't given the units, but in general, a very low anti-Müllerian hormone level is a poor indicator of ovarian reserve, and therefore usually egg donation would be recommended, I think, probably, but we'd need to know the exact units. How many times can a donor donate eggs? Well, on average, they would donate about 3 times, but if you are successful, we can often ask them to come back. They may want to come back, they may have moved on and not want to repeat, but it would be an average of about 3 to 4 times, and we are limited by the number of live births a donor can create, and that's 6 according to the law here in Catalonia. We have a frozen sample here. Would we be able to send that to Marquès? I'm assuming here is the UK. It's very difficult to send frozen samples from the UK. It can be done, but the HFEA want a very good reason to be able to do it. It's not easy. I was trying to do it for a patient today, and it seems to be virtually impossible. The HFEA are not really willing to do that kind of thing. So I don't think there's any more time for more questions. If you do have more questions, please do contact us. We will try to help you. We'll try to organise first visits as soon as you want. And I look forward to hearing from you. My colleagues here will hopefully help you create a pregnancy, I hope. Okay, thanks very much for your time.